Good morning, everyone. This is day 6 of the Dr. Johanne Louis Foundation Healthy Heart Walk Challenge. We're going to walk for 15 minutes for 29 days, and we are today on day 6. And this morning, I decided to do it before I go to work because I want to show you that you can do it anytime. You can just walk anytime. I'm so glad that you decided to take this challenge with me. I'm so glad that you decided to walk with me. I am so happy and joyful. It's early in the morning, but I said I made a commitment to you, and I'm glad that I'm keeping it, and you made a commitment to me, and I hope that you're keeping it also. So we're going to do this early morning walk. Oh, before I start working. And this is because February is Heart Disease Awareness Month, okay? The American Heart Association has designated February as Heart Disease Awareness Month because, as I've been saying in the other videos, that heart disease is the number one killer of women. 1 in 5 women die of heart disease. And I don't know, it's hard for me to angle the phone so that I can be in camera to show you that I'm actually walking. And I'm just walking in place, and I'll be putting some extremity movements into the walk because it takes your whole body. Just try to move around. Just move around any way you can. It really doesn't matter as long as you're moving for 15 minutes. Move for 15 minutes. Get the blood vessels flowing because we want a healthy heart. We want a healthy heart. There's not much room in this room where I am. And I said before I start doing anything, before I get ready to go to work, before I eat, before I do anything, let me put out the day 6 video so that you can know that I am serious about this commitment. Heart disease is very serious, okay? And I keep talking about women because it's the number one killer of women, but it affects men just as well, okay? Men are dying of heart attacks, men are dying of heart disease. But maybe I can get some men's attention because the heart, being the pump that it is, pumps blood everywhere throughout the body, correct? So that includes the penis, okay? So if you have a diseased heart, if you have a weak heart, if you have a heart that can't pump blood, I'm gonna kick, then you will not get enough blood supply to your penis. And if you don't get enough blood supply to the penis, then you may develop erectile dysfunction. And when you develop erectile dysfunction, you cannot have satisfying sex with your partner, okay? So, the heart is a very important organ. It pumps blood throughout the body. If it is diseased, if it is weak, then you basically, it causes a lot of issues, including erectile dysfunction, okay? So it's very important that not only women do all that we can, but men also should do all that they can so that they can live a healthy life also, okay? So that blood can flow everywhere, especially that very important organ, the penis, and also to the vagina also. We need some good blood supply there. But we're going to focus on blood supply to the penis. So men, if you have a diseased heart, if you have a weak heart, then you may develop erectile dysfunction. And some of your risk factors for developing such that can affect the heart are diabetes. Okay, so make sure that You go to your primary care provider, your doctor, your nurse practitioner. Make sure that you get your hemoglobin A1C checked. Make sure that your hemoglobin A1C is below 6. You know, we would love it if it was 5.5, 5.6, but let's keep it below 6, okay? And after you get your hemoglobin A1C checked and you're eating a healthy diet, you should also know your numbers and get your blood pressure checked, because high blood pressure is also a risk factor for heart disease and also a risk factor for erectile dysfunction. So you want to make sure that you have a normal blood pressure, okay? And we want the blood pressure around 120/80. Now, if it gets up the top number to the 130s, we're not panicked. Once we start going above 140, that's when we really have to really take a look at it and manage it, okay? So we talked about diabetes, high blood pressure, high cholesterol also is a risk factor, okay? So because you develop plaques on the walls of your arteries, the coronary arteries, that will limit blood flow, okay, to other areas of your body, including that very special organ, okay? The Mr. P, we call it, okay? And the Miss V, yes, I should say. So we want to make sure that we have blood flow. And all we're doing is just walking for 15 minutes. And I'm glad that you're keeping me company on this walk, because I made a commitment. This is very difficult, I must say. And I know these videos are getting, I know some people are just like, I can't watch another one of these videos. But that's okay. This is for me, because I want to keep this commitment to myself and to you, because I said I would, and I'm doing it. And you know, this early morning, maybe I'm going to start doing early morning, because it gives me a chance to really center myself in preparation of my day, okay? Before I start working, before I start dealing with the stressors. Speaking of stress, that's another risk factor for both heart disease and erectile dysfunction, okay? And we've been talking about stress all week long, trying to limit your stress, okay? Trying to make sure that we're not releasing all of those stress hormones that can cause vasoconstriction, okay? And decrease blood supply to our heart and to our sexual organs, okay? So how do we try to decrease some of the stress? Well, for everyone's situation is different, because I don't know what you're dealing with. You don't know what I'm dealing with. But one of the things that we talked about with broken heart syndrome is to basically find some time to just relax, okay? Find some time to center yourself. And what I like to do is to push out stress. When I wake up in the morning, I just say, stress, be gone. Be gone. I know that you're not going too far. I know that you're always back there, but you're going to stay back there for right now, because I need to be very present when I deal with stressful situations. I really need to make sure that I can keep my stress levels down, especially for me, because I do have a history of seizures, and because both of my parents had heart disease and they have high blood pressure, so I have to try to regulate my blood pressure. And as you know, stress makes your blood pressure rise, which then can impact your heart and cause heart disease. So everything, as you see, it's like intermingled. It's a circle. So everything interconnects. So if you have high blood pressure, that's affecting your heart, okay? The blood flow, it can't properly flow because it's pushing against that pressure. So it's going to impact your heart. It's going to impact your penis and blood supply to your vagina, okay? It's going to impact how you orgasm, okay? So this one is just dedicated to those who are concerned about sexual health and heart disease, because they are intertwined, okay? So it's very important that we take care of both, okay? And smoking, we keep talking about, because when you smoke, the nicotine causes vasoconstriction also. So it causes decreased blood supply to the heart, and it causes decreased blood supply to the sexual organ, the penis, okay? And so therefore, not only causing heart disease, but it's also causing erectile dysfunction, okay? Same thing with overconsumption of alcohol. Overconsumption of alcohol causes the same thing. That's a risk factor also. So we talk about all these risk factors, and let's not forget that we have other things like age and family history. All of these things come together. So when you go to your primary care providers, your nurse practitioners, your doctors, make sure you discuss all your risk factors that can impact your heart. And basically, if something is impacting your heart, it can impact the flow of blood to your penis. So sometimes you see that men have to take medications like Viagra, because what Viagra does is that it increases blood flow to the penis, because somewhere along the line the blood flow to the penis was interrupted, maybe because of diabetes, heart disease, maybe it was because of stress, tobacco smoking. Sometimes it may be structural. So once you start experiencing some erectile dysfunction, make sure that you go to your primary. We didn't do any knee lifts today, okay? Make sure that you get it checked out. Don't just not have a satisfying sex life. Make sure that you go to your primary care provider. Get that diabetes under control, okay? Get that blood pressure under control. Stop smoking. Decrease your alcohol consumption. Manage your stress, okay? You can walk with me every day for 15 minutes, and then you can continue walking for the rest of the day. You know, it takes more than 15 minutes, people. But what I said to you was that I'm coming into partnership with you for 15 minutes a day. And I have been doing it, and I hope that you're proud of me, because I'm proud of you for doing it. No matter where I am, I'm going to take those 15 minutes, whether it be at work, whether it be at home, whether it be at church, whether it be at the supermarket. I'm going to take those 15 minutes and walk with you. I just want you to remember to try to center yourself daily. Take a few minutes, meditate, sit somewhere quietly, think about the ocean waves hitting the shore. Just relax for a few minutes, okay? Move out the negative energy, bring in the positive energy. Pray, okay? Praise God. Praise God. You can raise your arms. You can raise your arms, rotate those shoulders, rotate the joints, lubricate the joints. I mean, yes, as you're rotating the joints, it lubricates the joints, decreases arthritis, okay? So exercise, eat a healthy diet, limit your alcohol consumption, do not smoke, get into good sleep patterns. I'm an insomniac, so I have a challenge with that. But we all can just do the best that we can, okay? And I share a lot with you because I don't want you to think that this is easy for me, because we all have issues. We all have problems that we're dealing with. But I am here for you. Please be here for me. I'll see you again tomorrow. Love you so much.